Meredith, let's talk about what to expect when you go into labor. Let's talk about your birth plan and kind of what you and Nick are, hoping to have when Tillman's born.
That sounds good.
All right.
Well, we filled it out, but I think we just want to go into more in depth.
Okay. Well, so you are over 37 weeks pregnant now, which means your term, which means that if you go into labor at any point, we'll let you have your baby. So things to come to the hospital for when you're full term. If you're having contractions, approximately every 5 minutes apart, okay? So I usually tell people, you feel like you're having contraction, take a look at the clock. If you say, in another 5 minutes, I'm going to have another contraction, and you're right, then come on into labor and delivery, okay? Other things to look for is if you break your bag of water. One of the ways you can tell if you broke your bag of water instead of like having your bladder let go is you'll feel sort of a continuous leakage. And if you put a pad on, it is just consistently soaked. So those would be reasons to come on in.
What color is it?
It can be anywhere from clear to slightly yellowish to slightly greenish. The vast majority of women is clear fluid, and you can't tell the difference between that and urine. So usually if you wake up in a big pool, put a pad on. If it's soaked in an hour, you broke your water.
And is that common? Do most people break their water?
A good proportion of women will break their water in early labor. So, but it's different with everybody. If you ever have any bright red vaginal bleeding, especially if it's heavy like a period, you need to come in and be seen. And then the other reason to come in is that if you don't feel him moving at all, okay? So those would be all things that we worry about in term. And the first three are more associated with you being in labor. Okay.
Sounds good. Can you kind of explain the options once we get to the hospital for pain? I mean, I don't want to be one of those people who are just epidural automatically.
So it depends. A lot of women are just more comfortable sort of up, walking around. We have a birthing ball. Some women find a lot of comfort if when they're having contractions, they sort of sit on the birthing ball. We let women kind of dictate what their needs are. Some women are perfectly fine, especially with the early contractions, just sort of breathing through them and stopping and resting. If you find your early contractions are still kind of painful, but not to the point that you want to get an epidural yet, we can give you some intravenous medications. So that would be something like Nubain. And we usually would give you that while you're in early labor. And then as you get farther along and you feel like you really need a little bit more pain control, that's where we probably would offer you the epidural.
Is there anything that I could take at home, like during early labor, to help with the pain, or you don't feel like even Tylenol helps at that point?
You can try. I don't think Tylenol is going to help so much with the pain. Usually what I found for women in early labor, the best thing is sit in a warm tub of water, put a warm heating pad on your back, have Nick sort of massage your lower back, and usually some of those sorts of things will kind of help ease a little bit of the contraction pain.
What comes after you say 5 minutes apart is when we need to get in the car.
Right.
So we've got a bit of a drive, 30 minutes, which I think could be a long time if you're in pain. But what's next? What's the next progression after the 5 minutes?
So after what happens is they become much, much closer together. So by the time you're complete and ready to deliver your baby, your contractions are about 2 minutes apart. So they can be pretty close and pretty strong.
So one of the things that you mentioned that the husband can start rubbing your wife's back, but is there anything else that you can do to help her get through it?
Yeah, so there's a lot of different things you can do. First of all, they need a lot of emotional support. So just kind of being there and, really kind of being present and involved and active in what's going on, usually means a lot. I actually had one husband who, when his wife was sort of laboring in the hospital and getting ready to push, he actually sat behind her and sort of would help hold her legs back when she pushed, help rub her back in between contractions, things like that. She's going to want things to drink, she's going to want to have her brow wiped, she's going to feel just kind of completely, sort of at the edge. And so, just helping her out with some of those little things and knowing that you're there, you're offering a lot of support and encouragement, that means a lot to moms when they're having babies. And then if you want, when the baby's delivered, if you'd like to cut the umbilical cord, that's another role dads usually like to play. So if you have a vaginal delivery, we'll usually keep you at least 1 to 2 days after you have the baby. The pediatricians like to watch the baby for at least 24 hours after delivery, just to make sure he's doing okay. If for some reason you would need to have a cesarean section, it would be more about 2 to 3 days after your cesarean section.
And then how is postpartum care followed up in the clinic after that?
So usually, usually you actually don't even need to come back and see us until your 6-week postpartum visit.
Oh, okay.
Yeah, and most of the time you're going to have so much to do going on with the new baby, the last thing you want to do is have to pack him up, pack yourself up, and come down to visit us. Reasons you would want to come in after the baby was born is if you're having trouble with breastfeeding, if you think you may have an infection in your breast like mastitis, if you're having really difficulties with bleeding and you think you're bleeding too heavily, or if you think you're getting sick. Those are all reasons that you want to come
sick as in a cold or flu or anything?
Sick, either that, but some people can present later on with an infection in the uterus, an infection in their incisions, things like that. Those are relatively rare. The most common reasons we see women back before the postpartum visit is